We are here today because on March 25th, 2019, the Trump administration filed a two-sentence letter with the United States Court of Appeals for the Fifth Circuit, reversing its own previous position in the case of Texas versus United States and asserting for the first time that it would not defend any portion of the Affordable Care Act in court. If the Trump administration's position prevails and the entire ACA is struck down, there will be catastrophic implications for millions of Americans and the entire United States healthcare system. I've often said that voting for the Affordable Care Act was the most important vote of my career. And let me tell you why. When Congress passed the ACA in 2010, we enshrined into law the promise that all Americans have the right to accessible, affordable health insurance coverage. The ACA established new protections to end legalized discrimination against approximately 130 million people in the United States with pre-existing conditions. The ACA authorized states to expand their Medicaid programs, and approximately 17 million Americans gained coverage as a result. The ACA created online marketplaces for consumers to purchase insurance with financial assistance through premium tax credits and cost-sharing reduction payments. And today, nearly 9 million individuals receive financial assistance to obtain coverage through the individual market. The ACA improved the quality of coverage for millions more by requiring that plans cover a set of essential health benefits, provide coverage for preventive services such as immunizations and screening tests, and allow young adults to stay on their parents' plans until they turn 26. If the Trump administration is successful, all of these federal protections will disappear. People with pre-existing conditions like diabetes, cancer, HIV, asthma, substance use disorder, or even pregnancy could be denied health care coverage or charged more. Babies born with health conditions could be uninsurable for their entire lives. And insurance companies in the individual and small group markets would not have to cover essential services such as preventive care, hospitalizations, emergency services, maternity care, and prescription drugs. However, since President Trump took office in January 2017, neither administration nor congressional Republicans have offered a plan to replace the ACA that would prevent coverage losses or the elimination of consumer protections. House Republicans have voted 69 times to repeal the ACA. Their last proposal, which failed to pass the Senate in 2017, would have increased the number of uninsured by 21 million people. There's something wrong with that picture. During the 2016 campaign, President Trump promised repeatedly that he would come up with a plan to replace the ACA, but never did. Never did. Now that he's running for president again, the promises have now returned. You'll be hearing them shortly if you have not already heard them. In April, he promised to release, and I quote, a really great, end of quote, plan after the 2020 election. Unfortunately, nobody has seen it. Ironically, if the Trump administration is successful in striking down the entire ACA, it would directly undermine many of their own policy goals, including tackling the opioid epidemic, lowering prescription drug prices, and ending the HIV epidemic. We wanted to hear from the administration about why they suddenly reversed their position in litigation. We wanted to know what the administration's plan is for millions of people if they win in court and invalidate the entire ACA. We invited the acting director of the Office of Management and Budget, Russell Vogt, to testify at today's hearing, but he declined. Apparently, he did not want to answer these crucial questions that affect so many millions of Americans with something that's very personal, and that's their health. I've often said to my proteges, the one thing that we must always ask ourselves every day, I think, and that is, what is the enemy of my destiny? What is the enemy of my destiny? What will stop me from reaching where God meant for me to go? And there's one common denominator that I've noticed that applies to all of us: health. Health. And enjoying a life where you can truly pursue happiness. So although the Trump administration refuses to answer these basic and critical questions, we are very fortunate to have a panel of legal and policy experts and patient witnesses who can tell us exactly what it will mean if the Trump administration is successful in eliminating the Affordable Care Act. And I ask our entire committee not to be blinded by what we see. Don't be blinded. The experts are here. They'll let you know. They are the witnesses. They are on the front line. They deal with these matters every day. And then there are others who have gone through and continue to go through difficult circumstances. I can relate. Now that I'm on a walker and I've learned what it is to be disabled. And it is a tremendous task in most instances just to get dressed. I got it. And I often say to our witnesses who have come to share with us your personal stories, thank you. Thank you for taking your pain, turning it into a passion to do your purpose. Pain, passion, purpose. And so they've traveled from across the country, from Utah, Missouri, Pennsylvania, New York, to share their stories with us. They're here to tell us what life was like for them and their loved ones before the ACA was passed. And so I thank you again. And with that, I yield now to the very distinguished gentleman from Ohio, the ranking member of our committee, Mr. Jordan.